The following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good evening and good afternoon, wherever you may be listening from. Welcome to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, where mind, mood, and what matters to you are discussed. We're broadcasting live from Toronto, Ontario, Canada, on Reality Radio 101. To get on board right now, send us an email. Our email address is instudio101@gmail.com. And now, right to your host of the Bear Psychology Radio Show, Dr. Anna Baranowski.
Hi everyone, I'm so glad to be with you here again today, bearing witness to evolving mind, mood, health, and conversations about trauma recovery, relationships, and work-life adventures. And today we're going to be talking about chronic pain. Now, I think this is a hugely important topic, and I find that in many cases people don't have this conversation. It's interesting. I've heard from a lot of people that their friends and their family don't want to hear about their pain anymore, that sometimes they get shamed for their pain at work, or people look at them and say, you look fine, so what's the problem? Turn that frown upside down. And these kinds of comments that actually make a person feel demoralized, humiliated. Chronic pain, it's a real thing, and it has a real effect on millions of people in North America and worldwide. It is a global epidemic, and it undermines people's ability to just even have a good night's sleep. Now, that's pretty rough. If you can't even sleep well, that on its own is going to undermine how you function in the day, your mood, all sorts of things. So, chronic pain is interesting, though, because it tends to create this kind of cycle where, you can feel pain, and then it creates a kind of like anxiety and tension in your body. You change the amount of activity. So you start, decreasing your physical activity. Your muscles get weaker, your joints get stiffer, you might gain weight, you lose muscle tone, you tend to not feel as well in your body because, the reality is our bodies are meant for movement. And in fact, movement can actually reduce pain. But as this is going on, you've had this signal for pain, you feel more stressed, you've got more tension in your body, more inflammation, more frustration, depression, you can't rest, you're tired, you're fatigued, you're not thinking clearly, and you can figure out what happens next. More pain. So this cycle can go on and on and on, and people get locked into it. And we need to figure out strategies for understanding how to take ourselves out of pain. And I've been reading all sorts of things about pain as I had this pain radio show coming up. By the way, if you want to be part of the conversation, you've had your own pain problems, you want to ask a question or just share your experience, email us at instudio101@gmail.com. We do not have a guest today, so I'm happy to dialogue with you out there and, talk about these issues. So if you're struggling with chronic pain, you're definitely not alone. There's an estimated 1 billion people across the globe. 1 billion, that's a lot of people, who suffer chronic pain every day. And, there's so many different approaches to dealing with chronic pain that I've come across. And, the problem is that one size does not fit all. And you don't want anybody saying to you, oh, yes, well, I have an answer and, it's working with the structure, or it's working with the brain, or I have these little techniques I could show you, or you can, do some relaxation and learn how to meditate. Yeah, that's fine. But the problem is one size absolutely does not fit all. And I want you to really take that on board, because I think one of the things that can really leave a person feeling hopeless is that you get told that you must have surgery, or you must meditate, or you must learn how to, go for your daily walk, or whatever it is that you're being told to do. You may try those things and find, in fact, it does not work. It doesn't even help you a bit. As a matter of fact, it might even make it worse. Even surgery sometimes makes it worse. Certainly, people can be given medication, and that itself may make it worse. So just keep it in mind that there are a lot of so-called solutions that may not be a solution for you. And I don't want you to take on the burden of self-blame if the thing that people are telling you is supposed to work doesn't work. Okay, so that's really, really important. So I want to go through this again. I want to actually talk a little bit about what would be considered persistent pain, or persistent pain cycle, or a persistent, like what's underneath a persistent pain or chronic pain disorder. So you would have this kind of experience. Maybe you had an illness, or you may have a genetic or chronic illness. You might have had an injury, and that leads to being less active. You lose fitness, your muscles get weaker, and your joints get stiffer. This creates a kind of like, okay, well, now there's so many things that I can't do anymore, and you limit your activity. You may find that without a lot of movement, you actually have a harder time falling asleep, even though you're tired. And then, you'll start worrying. Some people even worry about lying in bed because they're worried about not being able to fall asleep. And that creates a lot of discomfort. You may then start to, seek out medication, or, get medication to deal with all of these things, or whatever your disease profile is. And you may be having side effects from the medication itself. You might have weight gain or even weight loss. And both of those things can cause problems. And certainly, if you're carrying more weight than you're used to, the body has to carry that. And that's really hard. So you might start having some negative thinking. You might be afraid of how things are going to unfold, not feel confident about the future any longer. That's scary. So, your mood may start to really change. And, you may feel less confident about trying out new things, even though that's really one of the ways to shift off. Okay, so then you may actually take time off work. You're not making enough money. You're worrying about your relationships. You have all sorts of different concerns that start to become chronic, and then more pain. And of course, we end up having a real problem with this. So one of the things that I want to just talk quickly about is the work of Carol Dweck. And she talks about something called a growth mindset. Now, I want you to consider what that actually looks like, and understand that I want to reference this because this is actually really helpful when it comes to chronic pain. Because one of the things that I want you to be open to is everything. I mean, because we don't know in the end what's really going to be truly effective for you. I'm going to talk about some different approaches. But I think if we become too rigid and say, well, it's only a cortisol shot in my shoulders that's going to fix it, or only going to be meditation that's going to fix it, or it's only going to be my daily walk, whatever it is, don't get stuck on anything. So let's think about Carol Dweck's fixed versus growth mindset. So a fixed mindset is basically, I believe that, I've reached the limit of my abilities. I'm not going to be able to change anything. There's things that I either can do or cannot do. I don't want to be challenged. I can only go so far, and I have to give up and only stick with what I know. Okay. So now the growth mindset, and I love this. I mean, this is really powerful stuff. The growth mindset is that if you experience some kind of failure, like if the type of pain approach that is being considered or that you're trying out doesn't work, that's okay. You use that as an opportunity to grow. You use that as an opportunity to ask yourself, now what? What can I learn now? And allow yourself to say things like, I can learn to do anything I want. These challenges are going to help me grow. My effort and attitude will determine my abilities. Feedback is constructive. I'm going to talk to the experts or read what the experts say about pain. I like to try new things. So you start off with that and give yourself some messaging around what you can absolutely do. And I want you to use that as a real starting point, because it's really important. And it gives you the opportunity to really contemplate opening the door, like using everything that you're learning about to open doors rather than to close them down. So now I'm going to read from listeners throughout today's show. And the first one is from Amy. Hi, Amy. Thank you so very much for reaching out to us. Amy says, thank you for touching on this subject. Unfortunately, the majority of folks that dismiss our pain are medical doctors. A lot of them say it is all in your head. Well, maybe some of it is, but a lot of the folks get told that, and it is just not true. Thanks for letting me vent. Oh, thank you so much, Amy. You know what? I want to actually touch on that in a little bit more depth, because you're onto something really important here. And, unfortunately, this is a real concern. And there are people who've been writing and talking about what you're mentioning, Amy. There was a great article in the New York Times called "When Doctors Downplay Women's Health Concerns." It's not, but believe me, it's not just about women. This can happen if you are people who are less resourced. This is a huge issue for people of the BIPOC community, people of color, and people who don't have a lot of financial comfort, not heterosexual. So health disparities are not exclusive to women. So in the United States, and this is what the New York Times article says, if you're not wealthy, not white, not heterosexual, you may be receiving less than optimal health care. But researchers on disparities between how women and men are treated in the medical settings is growing, and it is concerning for any woman seeking care. The research shows that both doctors and nurses prescribe less pain medication to women than men after surgery, even though women report more frequent and more severe pain levels. A University of Pennsylvania study found that women waited 16 minutes longer than men to receive pain medication when they visited an emergency room. And women are also more likely to be told that their pain is psychosomatic. That's kind of like, yeah, it's all in your head, or influenced by emotional distress. And in a survey of more than 2,400 women with chronic pain, 83% said they felt they experienced gender discrimination from healthcare providers. And this is kind of scary stuff. because it becomes really important to recognize that if you go into a medical setting, that you have some clarity about using your voice, even if you need to write out little cards or put a note on your hand. You know, ask for, you know, guidance. You know, what are the guidelines around being fairly treated, being direct, you know, clarifying, like if the doctor or the nurse doesn't seem to be hearing you, just say, you know, I just want to clarify what I said. I want to make sure that you're hearing what my concern is, and just be really clear that it is reasonable for you to speak about your needs. My mother had a heart attack when I was in my late teens, and that was her first heart attack. And you know, at that time, it wasn't that common for women in their 40s to have a heart attack. And she was in a lot of pain. She went to the hospital. She did get good treatment. But, you know, it was a concern because there was always this question about what is happening with this woman, this fairly young woman, having a heart attack. And, you know, when you mention something like what you're talking about, Amy, it does make sense that, you know, you recognize it is true. You're definitely not making anything up. And this is a very big concern for a lot of people. It's interesting, actually, because one of my colleagues sent me a message about her experience. And she said, it's a necessary conversation. I live with complex pain. And because she looks like an able-bodied, racialized woman, she's not talking about it. And there are credibility issues that she faces in response to the medical professionals that she is asking help from. She has mentioned that she notices she's expected to have higher pain thresholds. This is very painful stuff. To even just to read it, I feel quite sad that my colleague is going through this. And she also mentions that there's research that suggests that Black children with appendix pain were held to a higher threshold of pain before receiving medical treatment. That is also really quite concerning. So, you know, from a psychological perspective, I'm also thinking about, you know, what is the heart of our pain? You know, what is really inside of us? Because I'm thinking about some of the different approaches, and I'm going to talk a little bit more about other approaches. But before I do that, I want to talk a little bit about the work on promoting awareness of pain. A local Canadian organization put together a charter of pain patients' rights and responsibilities, and I just love this. So let's see if we can take this on board for a moment. The charter emphasizes the following concerns about pain. Pain is a disease, not a symptom. Consumers should advocate for a greater awareness of chronic pain. Patients would benefit from better professional guidance to help them with information from various sources. And remember, this goes back to what I mentioned about Carol Dweck. Always try to figure out what strategies you can use to learn more and to open more doors to see what might be the best approach for you, because you may end up having to close a lot of doors that really don't work for you. Patients have rights and responsibilities and can work together with healthcare professionals, taking an active part in their own care. And yes, absolutely become informed. Children and elderly, or those who are cognitively impaired, have the right to have their caregivers involved in their care. Makes sense. You have rights. Pain patients are entitled to have their reports of pain taken seriously. And this is really important. Receive compassionate and sympathetic care. Have treatment, follow-up, and periodic reassessment. Actively participate or have others help them participate in treatment planning, timely access to best practice care, adequate information in order to consent to the treatment, information, support, and even access to health records. That's actually your right. Responsibilities. Now, this one is really interesting. To the extent that you are able, or the people who are helping you are able, be knowledgeable about pain. Like, what is this thing called pain? And I'm going to talk in a minute about something called the pain gate theory, which I want to explain to you. Engage in open communication with your healthcare providers, actively participate in your own care and decisions about care in partnership with healthcare professionals. Try your best to, comply with treatments, try it out to the best of your ability to see if it's actually useful for you, and then advocate for better pain management. And, I really hope that, like I said, you use all of this as door openers so that, your focus is, what can you do today? Thanks. This is another email, and this is from Brenda. Hi, Brenda. A lot of misdiagnosed pain issues are with fibromyalgia. A lot of people in the medical profession still do not totally understand that illness. Yes, absolutely. And it is something that does not kind of really sit well with a lot of medical professionals. There's notions about fibromyalgia not being real, people not really experiencing pain when they have fibromyalgia. It can be very problematic and leave people. This is the issue around feelings of, humiliation and shame, because you're feeling something that is so devastating for you that you cannot tolerate the discomfort. And in some cases with fibromyalgia, you're not even getting out of bed, or the pain is burning to such a degree that it's devastating. So let me talk a little bit about the pain gate theory and, the gate control theory and the brain. Now, this was based on researchers Ronald Melzack and Patrick Wall, and they proposed something called the gate control theory of pain in the 1960s. And this theory suggests that the spinal cord is kind of like the conduit that creates a gate, a neurological gate that either blocks pain signals or allows them to continue to the brain. And that's really interesting because there's certain activities that can actually shift focus. So if, for example, you put your teeth on your lip and you just press down a little, to the, increase pain to like a 2 or a 3, not so you're causing any real pain, but so that you feel something. If you did that right now and you press down on your bottom lip a little bit with your teeth and just felt that. And then if you took your hand, either right or left, and you just shook it, shake. So let's try that all together. So you're going to bite down only to the pain number of a 2 or a 3 on a 10-point scale, feeling it, and then shake your hand. What you'll probably notice is that you're feeling the shaking of the hand, but not what's happening with your lip anymore, because what's happening is you have 2 different messaging systems. One is geared towards the brain listening to big movements, and one is this pain. Now, the reason for that is that, let's say you had experienced some kind of dangerous incident and you needed to run away. The brain is always going to go with run away, get yourself out of harm's way. And that got kind of developed in our bodies and beings to help us survive dangerous situations. So, there's a reason why one of the best things to learn how to do is to move. And it doesn't matter actually if you're sitting in a warm pool on a chair, moving your arms up and down, so that, the body doesn't have a lot of weight on it, or weight resistance. I mean, water therapies are really profoundly helpful because you're not doing a lot of weight bearing. And for some people, that's how they start and continue to stay well throughout a lifetime. This is another one of my mom's stories, is that she was a pretty clever woman. She did a lot of things that were very Carol Dweck, so to speak, like, always keeping in mind that there are many things that we can do to continue focusing on the positive improvements in life, and making sure that, we're in a growth mindset. So she used to go, because she had a lot of physical ailments, she used to go to a pool, a warm pool, and she'd do in-pool exercises in a group. Actually, for a while, she was leading the groups, because it was a motivator for her. So that was kind of nice. And again, really sitting in with this growth mindset. Try everything, be open to everything that might help. Okay. So thank you for that. And let's read our next one. This is from Gail. Hi, Gail. Thank you again for reaching out to us today. Gail says a lot of medical practitioners prescribe medication for chronic pain, and sometimes that is in fact necessary, but most of the time, unless the pain is severe, exercise, diet, holistic and herbal supplements, meditation, etc., are the best way to conquer chronic pain, unless it is severe. Yeah, or unless there is like something going on where you absolutely need a surgical intervention or something like that. The previous 2 weeks ago, 2.5 weeks ago, it's been a busy couple of weeks, I have to say. My uncle contacted us here at the house and said he was in a lot of pain. And we didn't know what was really going on, because the week before we had taken him to the hospital because he was in a lot of pain, and they did a whole bunch of tests and then sent him home. Now a week later, he is notifying us that he's in really bad pain, terrible pain, and wants to go to the hospital. He did end up at the hospital. He was admitted, and within that week, thank goodness he was in the hospital, he had a burst aneurysm. And we know why he was in so much pain. So I don't want anybody to get the wrong impression that you should ignore your pain, because, there are certain moments in time where you really need to pay attention to your pain, especially if it is acute, and especially if it is unfamiliar pain, or, something that has happened, some accident, or something acute that is occurring in real time. So, if something is unusual pain, it's probably something you need to be noticing. But I have to say, Gail, I do agree that a lot of the things that you're suggesting, exercise, diet, supplements, meditation, they are really good starting points. Okay, so I'm going back to the gate control theory and the brain. So researchers have observed that factors such as thoughts, emotions, and expectations can influence our sense of pain or perception of pain. And if you expect something to hurt, it's probably going to hurt even worse. And if you're upset or frightened, pain may seem more intense than if you're calm. So unlike an actual gate, this pain gate theory, which opens and closes to allow things to pass through, the spinal cord operates by differentiating between the types of fibers carrying pain signals. And pain signals that are traveling via the small nerve fibers are allowed to pass through, while signals sent by the large nerve fibers are blocked. So the pain gate theory is often used to explain phantom or chronic pain. So remember, I had you bite your front lip? Those would be the small nerves. So you might feel a pain from something that is no longer injured because that gate to those small nerves it's still open, even though there's nothing really happening anymore. So then you need to start training your brain to recognize that this injury is no longer kind of active anymore. Now that's a big thing. That is when we start to recognize that we need to look at pain from a very different kind of focus. And this brings me to the ACE studies. So what's an ACE study? So the ACE study is the Adverse Childhood Experience study. And, I've spoken about ACE studies before, adverse childhood experiences before. And, this is a really, really interesting study. The Adverse Childhood Experience study was originally published in 1999, and it was the first large-scale study to look at a relationship between 10 categories of adversity in childhood and the health outcomes in adulthood. So we know from that study that what ends up happening to people is if they've had physical abuse or emotional abuse, neglect, parents who are addicted or narcissistic, that you are more likely to experience adverse childhood events that, then result in problems with your emotional health, your physical well-being, pain, engagement in the criminal justice area, having problems with the law, addictions yourself, and chronic pain. So, this is something to keep in mind, because I really want you to understand that there is something very connected between what might have happened in your childhood and the pain you're experiencing now. Now I'm going to talk a little bit more from a perspective of kind of a psychological focus. There are a lot of people who are going to suggest all sorts of different avenues for self-care and treatment. And absolutely, I want you to think about that. It might be medications or injections, physical therapies, laser therapies, surgery, exercise. But there is also a psychological approach, or many different psychological approaches. Some may be really great for you, exercises to relax the body, guided meditations, different kinds of self-care strategies. These things are very helpful, but what I have been coming across a lot lately is the work of Dr. John Sarno. And his work is really, really interesting, because what he's really doing is he's looking at pain from a very particular lens. And that is the lens that we really, start to understand from the perspective of what has happened to you and how that has shaped you to carry pain emotionally and within inside of your body. Okay, so I'm going to come back to that, but that's where we're headed. Okay, so let's read a little bit more from our listeners today. Joe. Hi, Joe. What about mental pain? Yes, see, here we are. This is exactly where we're heading, Joe. Thank you for raising that topic. I agree 100%. This is a huge, huge issue, and we have to pay attention to it. I'm going there. And I'm going to spend quite a bit of time on that, because it's actually something that I think is very forward thinking. And, I'm excited to focus on this. Let's read a couple more. And then we're going to go a little bit more into the work of Dr. John Sarno and his colleagues. So this is from Madden, and Madden says pain medication is not always the answer. A lot of people get addicted to it, and in the long run, it sometimes affects the body in very negative ways. Some people have overdosed on it, and some have died due to system failure, heart, kidneys, liver, due to long-term use of pain medication. Medication should only supplement pain treatment while looking at alternative things to do to relieve chronic pain. Thank you so much, Madden. You're absolutely correct. I think there's something really important about this issue. Now, people get into a lot of trouble with pain medication, and it does tend to help in the short run. I mean, if you've had any surgeries or you've had an acute injury, I broke my ankle in the summer. That was painful. So I was fortunate, and I was given a few tablets of pain medication that had codeine in it, and that helped tremendously. And I'm a very active person, so as quickly as I could, I started to move around, and that was really helpful. But I can see how easy it would be to rely on the medication and not move. So this is where, a comprehensive approach to dealing with pain and structured supportive systems that are beneficial and not judgmental can be incredibly helpful, because a lot of times actually, the pain medication is blocking out our emotional pain as well. So let's keep that in mind too, that, sometimes people get addicted because they're experiencing a tremendous amount of emotional pain as well. Okay. So this one is from Rhonda. Hi, Rhonda. Rhonda says, I love the lip hand experiment. Great. Yes, I came across that on a video by a chronic pain specialist who talked a bit about that. And I found it really a good experiment as well. And it does do a good job of explaining why, full body movement can be very helpful. And I'm not saying that you should do full body movement if you are actually injured. We have to be careful about these things and really pay attention to ourselves, because I think, sometimes we can have a overly demanding expectation of ourselves. And I really like the idea of listen to your body and notice, what are you capable of doing today, so that you are challenging but not injuring yourself, right? Challenging but not injuring yourself, keeping that in mind. Okay, and this one is from Tommy. Fantastic show today, listening from Youngstown, Alberta. Oh, well, thank you very much, Tommy. I'm glad that you're with us today. And then also from Dawn, who says, pain is a way of the body to state that something is wrong. See, you listeners, you're so smart. I just love it. It's just so great interacting with you, because I think that there's a lot of wisdom in the audience. So Dawn says, pain is a way of the body to state that something is wrong. We should never ignore it. I'm not talking about stubbing your toe on the bed frame. That happens to me. But if you have pain somewhere, you should always get it checked out. Yes, and no, Dawn, because the problem is that sometimes we really know this particular pain, and this particular pain is telling us something about a complex issue that is below the surface. And I'm going to talk a little bit about that through an example. So I've got in front of me the Mind Body Workbook. It's a 30-day program of insight and awareness for back pain and other pain disorders by Dr. David Schechter. And he is talking about his own experience. So David says, my first exposure to mind-body medicine was the diagnosis of tension myositis syndrome, which I received as a medical student at New York University in 1981. David was suffering from severe knee pain, worse with running at basketball for some time. During my freshman year in medical school, the knee pain became severe enough that I was forced to curtail these two recreational activities. And when I did so, my knee pain got a bit better, but any attempt to return to sports made it worse again. I sought treatment at Student Health and was referred to an orthopedic professor, one of the New York Yankees team physicians. He prescribed anti-inflammatory medication and an exercise program, and I diligently performed these exercises and strengthened the muscles around my knee. Despite this added strength, I still had pain without any significant athletic activity. The next step was an arthrogram, an x-ray test that involves the injection of a dye containing solution into the knee joint. And yes, that is as painful as it sounds, especially when performed by a resident in radiology learning the procedure on my knees while the professor was supervising him. The results were negative for any tear that would require surgery, and they showed a normal variant appearance to my meniscal cartilage, which the orthopedic surgeon felt was not significant. I was advised to keep doing my exercises, and that surgery was not likely to help in my case. Now, I want to say that this is when it gets very interesting. This Dr. David Schechter is talking about his experiences from when he was a student himself. But he went on to actually be diagnosed with tendonitis, runner's knee. But he went on to seek the advice of Dr. John Sarno. He was a professor of rehab medicine at NYU at the time. And Sarno lectured in a class on anatomy during Dr. Schechter's first semester in school on musculoskeletal system. And Dr. Schechter sought him out because, he was trying to figure out how he could help himself. And remember, this whole conversation about Dr. Carol Dweck's work, The Growth Mindset. Dr. Schechter was frustrated, and, the things that he was told would help were not helping. And so what did he do? He opened up his mind and he looked for other advice or other approaches. Dr. Sarno said to him, the advice that Dr. Sarno gave him when he entered the office was surprising and career modifying. After a very brief discussion of pain and the symptoms and normal test results, he told me, in his experience, 95% of these people with chronic pain syndromes were tension related. Now, remember, we're not talking about a person who has an acute injury or an illness or something that must be addressed with some kind of specific kind of treatment or intervention that is known and evidence-based. We're talking about this situation with Dr. Schechter, at the time a student, who had pain that wasn't resolving and tests that were showing that, in fact, he was actually not showing significant abnormalities. So it became really important to recognize something else was going on, and we didn't know what it was. So tension myositis syndrome, or mind-body syndrome, was the name given by Dr. John Sarno to a condition of psychogenic, musculoskeletal, or nerve symptoms. It could be back pain, but it could be many things. Somebody mentioned fibromyalgia earlier on. It could be a lot of things. And Dr. Sarno has written a number of books. I've got the Mind-Body Prescription in front of me, Healing the Body, Healing the Pain, and it's still available for purchase. And the treatment really using Sarno method is education, writing about emotional issues, as much as possible, resuming activities of normal life. So, if you like to go for walks daily, or you had a group of people you played card games with, re-engage in as many of those normal activities as possible. Start to attend support meetings, engage in psychotherapy. The issue is that there seems to be some very close link between what is happening in the unconscious mind and our current pain. So we're going to start to listen. What are our anxieties? What are our past traumas? What are we afraid of? And really notice the connection between the pain and discomfort you're feeling right now and what it might be connected with. Where is it within inside of yourself that you can notice ignites kind of pain in your body today. And everybody experiences pain in a different way. I know when I was very young, I used to get a lot of migraine headaches. And I needed to do a lot of kind of my own deep reflections around, what was really going on that was creating so much pain in my head. It became a real point of focus. So I had to do my own contemplations when I was younger to understand myself better. That's kind of one of those, my responsibility as a human being is to pay attention to myself, as it is for all of us. So being aware, and this is a really important piece, being aware that for some of us, our emotional pain is so acute, so severe that we would rather not feel that pain than feel the pain in our body and our backs. So what I'm saying to you is you may be struggling with something that you can actually link back to your own historical emotional pain and suffering. Maybe you grew up in a home where there was terrible tension and strain. I'm going to go back to Dr. David Schechter's book for a moment. So Dr. Schechter then remembered his own experiences after Dr. Sarno said that, he may be experiencing this tension myositis syndrome. David was stunned at this unexpected suggestion and responded that he heard of migraine headaches due to stress, but knee pain from basketball. His response was to invite a more detailed consultation after that seminar. And David went ahead with that. He attended a presentation. He learned a lot more. And gradually became aware of the fact that he was prone to physical ailments related to stress, that he had irritable bowel syndrome when he was a young teen, and recognized that he associated them with social events, and he could feel his symptoms worsen when he was invited out. So his athletic competitions during college tended to evoke many of the same symptoms. The family doctor mentioned stress in response to a couple of minor illnesses. And when David started to listen to what Dr. Sarno was saying, he started to do some personal deep dive into his own experiences, irritable bowel, allergies, asthma, migraines. He started to recognize that his own tendencies to worry about knee pain and his experience with his own body seemed to connect back to his own emotions. So he was pretty blown away by this. And, I've been having conversations with clients of mine who are using the app Curable based on the Sarno work, Dr. John Sarno's work, and, subsequently this work by Dr. David Schechter. And I find that these resources are really helpful because there's something that you could really take on yourself and try to make sense of what's happening within inside of yourself. And again, don't bypass the other things that are available. This is from Joanne. Hi, Joanne. What about cannabis for chronic pain? Your thoughts? Beautiful question. Absolutely. Now, this is just, this is again, I keep on going back to this idea of the growth mindset. If you find that this is an option you're open to, cannabis for chronic pain, you may find that it actually is a very beneficial approach. For a lot of people, it makes the difference between a pretty significant autoimmune response or inflammation in the body. And that could be really the start of lowering your pain problems. But just with any medication or a substance that you might be using, always keep in mind that you want to use things in moderation, and continue with some of the other things that you might want to work with, like maybe this approach, the mind body approach with the Dr. Sarno work. And there's lots of material out there for you to consider. I like actually bundling my treatments so that maybe you're going for daily walks, maybe you're eating an anti-inflammatory diet, maybe you're using a number of different heating pads on your body, or allowing your body to relax using guided meditations. The idea is that you don't want it to be about one thing alone. So absolutely find ways that might help you. And if that's something you are open to, I think that's fantastic, so that you can give yourself a little bit of a break in that way as well. So absolutely. And then let's take a look at the next one. Fantastic show today. I learned a lot. Here is to all the people out there with pain, blessings for relief. I know it is such an important thing for us to keep this in mind, that, and this is something that can really happen to anybody. I mean, chronic pain, it's not something that is limited to, people who have, historical issues with, family of origin. You may think of pain just like a symptom, like, oh, I have this problem. I've got, I hurt my foot, and, I've got to, soak it in a tub or whatever, like it's one thing. But, there are cases where the nervous system develops a feedback loop, and pain becomes this terrifying, horrifying disease within itself. And, there are a lot of really interesting people who can share a lot of their wisdom. There's a Dr. Elliot Crane. He did a wonderful TED Talk, and he talks about this young woman who experienced allodynia. She fell, and she broke her wrist or her arm, and instead of it healing right away, cast it and then it recovers, it became inflamed, so that any touch felt like searing pain throughout her arm, up her forearm, into her shoulder, down past her wrist, and into her hand. And in the TED Talk, you can see an image of her right and her left hand and arm, and you can see how one is in an inflamed state and the other just looks like a normal hand. But the idea is that what was a minor injury turned into a chronic and complex pain syndrome, in which there was a very, very slow recovery trajectory, and just horrific chronic pain for this young person to deal with. One of the big problems, of course, is that when pain is invisible, your needs might not be taken seriously by medical professionals, leaving me, if I find myself in a position like that, suffering without any solutions that meet your overall needs. Because, pain it's complex, and one solution, it just doesn't fit everything. And in most cases, there's a need for approaches that include medicine, physical therapies, mind-body approaches, like the one that I was discussing, Dr. Sarno's work, counseling, rehab. And not everybody has all the resources for all these therapies, but without them, you may be left suffering from pain and not having sufficient relief. So what I would really encourage you to do is to start considering what are the simple things that you can do every day. Increase your movement if you can, go to a heated therapy pool, use hot pads, sleep with a big bedroll or pillows between your knees, allow yourself to, talk to a close friend, start to understand what happened to you over the course of your lifetime when you were younger. Writing can be an incredibly powerful way of beginning to shift around your pain. As a matter of fact, there are a lot of different writing exercises that I think are very, very beneficial, that can make a huge difference. Now, again, Dr. Sarno's work is out there, and, for sure it gives good outlines for, writing out what has happened to you and really trying to make sense about your history through talking it through, but also through writing it through. And I'm going to go back for a minute to the Mind Body Workbook by Schechter, because it's not very expensive. You can order it online. It's got a lot of little insightful exercises, and it goes through a whole program, a 30-day program, in which you can actually start to really understand from the starting point, what is TMS, what things might you consider. And it's interesting because he starts with things that you might notice about yourself. So, for example, just think about this as you're listening. You may experience tension myositis syndrome if you have a tendency for perfectionism, being self-critical, overly responsible, control-oriented, being a people pleaser, or overly highly conscientious. And, you may, as a result, experience chronic pain or discomforts, and experience allergies, asthma, fibromyalgia, irritable bowel syndrome, TMJ, that's temporomandibular joint syndrome. That's when your jaw is really tight and it's really sore. Unexplained pelvic pain, tension headaches, TMS, migraine headaches, and many, many, many other things. Now, if you are finding that you have been trying to figure something out, keep going to the doctor, they keep telling you there's nothing they can do, or the things that you've tried don't work, then maybe consider taking the time, leaning into yourself, asking yourself, what is the heart of your pain? What is at the heart of your pain? And be open to hearing and listening. Allow yourself to really show up for yourself. Sometimes that is a huge shift in what happens in our life. Would you rather not know or feel your emotional pain if the cost is chronic, life-threatening pain that keeps you up at night, devastates your financial situation, leaves you an emotional wreck, yelling at the people that you love? Just see if there's a piece of that is playing out in your life, and be open to all the different ways in which you might be able to be kind to yourself, find ways that may help you feel a little bit more at ease, recognize that you are entitled to good care, and that it's a reasonable expectation that you can rely on folks to help you get through your day. And, just understand that, there are a lot of reasons why you might have chronic pain. Some of them might be genetic. You may have had injuries that are not resolved. You might have symptoms like one user, Izzy Kornblau, She's got a YouTube channel, and she's got a whole lot of chronic pain management tips and tricks because she's got hypermobile Ehlers-Danlos syndrome. And she is constantly in pain, and she's a very young person, and she recognizes that there are so many things that seem to help her, and she has to kind of keep upbeat about it. So heating pads, KT tape, massagers, ice packs, heat packs, rollers. I just want to tell everybody listening today that I want you to feel like you can have a growth mindset, focus on your well-being and recovery. And I wish you all a gentle day and that you can take care of yourself.
Thank you for listening to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, right here on Reality Radio 101.